The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. Indeed, we are live today, and we have a very special program, one that kind of fits the pattern for all of us. You know, how do we stay strong? How do we keep our immune system where it needs to be? And it's something that we deal with on a day-to-day basis at the Roselle Center for Healing. We try to get people's immunological systems to optimize themselves with, and regardless of what their pain patterns are, because, you know, at the end of the day, you really don't get sick, you don't hurt, you're not in pain, you don't have all kinds of things bugging you, so to speak, if your immune response is as strong as it should be. So we're going to walk down the weeds on this thing, and we're going to give you tools to be able to strengthen the system, but who better than Dr. Stephanie Pina, our doctor of naturopathic medicine, who will be your host, your presenter this coming Wednesday evening at the Roselle Center for Healing, and is our guest. You realize when you come into our office, it is a very safe environment, from HEPA filters and ionization filters, and we scrub down, and, you know, we make sure that you're comfortable in how and where you sit, and you will be very comfortable. But this Wednesday evening at 7 p.m. at the Roselle Center for Healing in Fairfax, we're just off the National Capital Beltway, literally about a half of a mile. You'll find us easy to find. All you have to do is call the office at 703-698-7117, or simply go online to register at rosellecare.com. That's ROSELLECARE.com, and register. Just click the button, and we will confirm a seat for you, and we'll see you this Wednesday evening. Dr. Stephanie, welcome again. You know, you are the pro on this program. You know, not only are you an amazing source of data and information, but you know how to run this thing because you step in for me when I'm not here.
Yeah, it's. I feel like we have this topic and it's over and over and over again, but, you know, we try to throw new information in and stay updated, and then the patients come in with more and more questions. And so why not keep repeating it and change it up a little bit, spice it up a little bit. So, yeah.
Well, if you look at it from different positions, you know, in our office, we look at the structural, chemical, emotional platform as the triggering mechanism for so much that is bugging us. And, you know, disease processes are simply diagnostics that doctors give to symptom presentations. That's all it is. I got a headache, I have a fever, I have this, I have that. Oh, you must have this. And then now they've gone to the sophistication of giving everything an alphabet soup. You know, this is what you have. Well, that's not what we want to deal with. I don't want to deal with the symptoms. I want to deal with the why, and how do we, you know, prevent things from occurring to begin with. So, you know, let me ask you this question. We spoke about it just before the program started. Why do some people apparently can be exposed to anything, whether it's COVID or it's any other infectious type of disease, and they're cool, there's no problem. They seem to just keep on going on and nothing ever happens. And the same thing with, you know, we know people that drink a quart of whiskey a day and smoke a pack of cigarettes, and they live to 100 and they die in their sleep. And, you know, the rest of us don't make it like that. What seems to be the differential? Why are some people so strong and others seem to get everything or break down and have all kinds of problems?
That's a great question. And really, when you think about research out there that's been talking about, you know, different types of groups of cultures that have been living over to their hundreds and everything, like the blue zones or the green zones, you know, they're trying to figure out what's that one thing that makes these people healthy to continue. And the amazing thing, there's not just one thing. But I do think what it comes down to is that people who have some kind of basic health system and their bodies are able to function, they're taking care of themselves on a daily basis, are the ones that are able to essentially get through some of the stuff that passes through, because we're always surrounded by bacteria and viruses and mold, and you know, the foods that we bring in are not always clean. So those are always going to be there, but their digestive tract, their immune system, their mental mind body connection, all of that has a chance to kind of be somewhat imbalanced enough that they don't have these big responses. Or if they do, which we do want people to have that common cold and flu every now and then to kind of recharge the immune system. But when they do, they recover very quickly. So there is something that's underlying that it may be different for one person or another, but essentially what we want to try to do is optimize that and create a balance so the immune system can respond when it wants to respond and needs to respond, but then it also knows how to shut off and not create chronic issues and chronic inflammation and start attacking other parts of the body too.
You know, the interesting thing is there's some people who, you know, at the first sign of a sniffle, or, you know, they're tired, or they don't feel good, or they got a little scratchy throat, they throw up the panic button. You know, the flag goes up and said, oh my God, what can I do to suppress the symptom? That's not necessarily a very good thing to do. It actually can cause things to become worse, correct?
Correct. But the positive side of that, the silver lining of the person who panics at the first symptom is they know something's not right. So you got to give them that benefit. They say, something's not right with me. I feel wrong. It's just, how do they approach it? How do they treat it? What do they do next? The next step. I mean, we love it when we have patients that come in that says, like, I don't feel right as of this morning. Like, what can we do right now? Because they're aware that something's just off in them. And then they give themselves their time and the space to actually heal, and instead of trying to say, well, I'm just going to push through everything and I'm going to keep going to work. And I mean, if there's anything that we've been looking at for the last couple of weeks and years, is that when people started to get that sniffle or a cough or the cold or the sneeze, and they questioned what they might or might not have, at least they decided to stay home now. Before, we were just gung-ho, let's go into the office, we'll wake her through it, and then all of a sudden everybody else in the office is sick as well too. Yeah. So the person that's really watching their health is going to be the person in the office who doesn't have the sneezes, and everybody else around them is the one that's sick.
That's, you know, that's really a good point. And when you realize that there's little things that are sitting there. I had a patient that called in the other day and said, you know, I'm really feeling good, and but I'm tired, and I think I lost my taste. Do I have COVID? I said, yeah, probably, maybe. And I said, you know, if you wear an N95 and come in the back door, I said, I'll test you and make sure that you're okay. And he said, yeah, that's what I thought. I really might have this thing. I said, yeah, give yourself 5 days. If you get anything more than that, give me a call. And we go, but he called me about the next day. He says, it's gone. Am I still contagious? I said, stay home for the next 3-4 days. I said, you know, the rules are that if you do test positive, I said, your symptoms tell me that it's problematic and possible. I said, but, you know, just start counting it from the day you called me. Give yourself 5 days. And if you still stay strong with no symptom process, you're good to go. But we don't understand what that really means. Let's talk about immunological responses relative to we'll talk about viral patterns, okay? Whether it's this COVID that's out there, or the flu, or a head cold, or anything else. The problem is that we really can't differentiate. And with the Omicron, with the exception of a very small amount of people, it's really a uncomfortable cold for a day or two with a little bit of fever, sore throats, body ache, fatigue. That can hit so many different places, right? So let's talk about how we stay strong in any viral condition. So our body, one, fights it if it does show up in a symptom process, but preventing it. What can we do to make sure that we're solid?
Well, what's interesting, I think, with what's going on right now, and to answer the question, is we have to think about everything that's going around. Like right now, we have hot temperatures, cold temperatures. We've got snow, we've got rain. You know, here in Virginia, you never know what you're going to get when you walk outside the doors. So, you know, if you're not prepared to go out in the cold, you're putting yourself more at risk for your immune system to kind of kick back in. So we have to deal with what's outside. You know, we go into the spring and all of a sudden now it's allergy patterns. So, or it's mold in the summertime. So we have to worry about what's going on with our outside environment and make sure we're okay. The other thing we have to do is what's going in when we're eating foods. You know, the digestive tract is another part of our immune system that we kind of overlook until we have an upset stomach, or till we have some kind of digestive issue that needs to be treated.
Or but really, constipation or diarrhea and so forth that everybody ignores.
Exactly. Well, both of those can be ways of kind of trying to hold in good nutrients or eliminate the bad stuff, right?
That's right.
So we want it to eliminate the bad stuff. We just don't need to hold as much as some people do. But when we look at this, what tends to happen is we have to think about what's going in, what we were exposed to. And in Chinese medicine, you know, they used to have these 5 or 6 outside factors. And then they throw the emotional factor of the body. How are the emotions affecting our disease process? It was its own pathogen. In fact, diet and everything was a different set of stuff. But outside, you know, if it was hot or it was cold, what was our body temperature? Are we overrun or overworked? You know, these are not things that we normally think about because we get used to doing things on our day-to-day process. And so we have to take that time for ourselves, so that staying home and hopefully not trying to do stuff at home all the time too is a way to kind of help and heal. And so you can get the rest, you can get the sleep that's so important for your immune system, and give yourself a break and give yourself the time to heal. Because most people say, I feel better today, I'm going to go out and run out and do all this stuff. And I'm going, too soon. So we want to come up with ways to help strengthen the body through Chinese medicine, herbal medicine, dietary medicine, the different modalities that we offer that allow the body to conserve energy and allow that to go towards healing or the continuation of healing, and then start to go, okay, now I feel better. I can go out there and do things in the world again.
So I got an interesting question for you. And the patient asked me this about a week and a half ago, and I opened the paradigm for them a little bit. Who gets potentially more symptom presentation? And I use the word sicker, which is not something I like to use, but somebody who has exposed themselves slowly, getting outside, you know, seeing people and so forth from the time we're a little kid all the way through, or somebody who's isolated inside, never, you know, masks up, doesn't expose themselves, and all of a sudden goes out in the middle of whatever happens to be there. It might be a head cold or some other kind of bug or this stupid thing that's out there. Which one is potentially the one that's going to succumb?
Oh, good. I thought you were going to ask between men and women, like who's going to get sicker first. So
not yet. That's the next
one. Oh,
one.
good.
We'll talk about that later.
That's what I'm going to create the debate right now.
Not yet.
I would potentially say that the person that's going to go out there and has those little exposures over time, we see this with other conditions, especially like with allergies, right? If they have small exposures, and this is the way like allergy shots work, right? Their body is able to take it in a little bit and deal with it and kind of go, okay, I know how to combat this. And then they can take in a little bit more and combat this. It doesn't mean you throw out all other precautions and go run out. But I mean, this is what people used to do with chickenpox, right? It was chickenpox parties. One kid on the block had chickenpox. Everybody brought their kids over to the house and they just let it go through and then they're all set. Well, that's a viral infection.
Sure. What they forgot, though, that chickenpox was contagious before they broke out. Once they broke out, they weren't contagious anymore.
Well, that means someone at the party probably also already had it. So it just helps spread it a little bit faster. But
that's right.
But essentially the same thing goes. If you have a little bit of an exposure over time, your body can deal with it. It can assess it. But when all of a sudden you get hit really hard because you haven't had any exposure, your immune system's seeing this for the first time, and it's a really big deal now.
I'm going to have you hold that thought. We're coming up to a break, and I want to continue right on that subject. You're listening to Dr. Tom Roselle Live. My guest today, Dr. Stephanie Pina. We're talking about your immune system and how to protect it. We'll be right back after some important messages. Don't go away. Welcome back, everybody. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We have a really interesting, appropriate, and timely program. And, you know, my guest today is one that knows this area of application in health probably better than anybody else. Dr. Stephanie Pina, who you know as my co-host and just jumps in for me on a pretty regular basis. We're talking about what happens with your immunological system and how it protects you, how it doesn't protect you, but more importantly, you know, from other perspectives, Chinese medicine and the things that we do on a regular basis. Anyway, welcome back, Dr. Stephanie. Let's get back into a little bit what we were talking about before we had a break for our sponsors. The differentiations in why some people seem to be impervious to everything and some people seem to succumb to, you know, walking 20 feet away from somebody fully masked and they still get something. That's a conundrum for so many people. Why? You know, why does that happen? Why can I walk, for example? You know, I got a little bit of, a fever and a sore throat and fatigue pattern over the holidays. And, you know, I wasn't in the office. I hadn't been there for quite a while. And, you know, I said, Dad, do I have this stupid thing? You know, did it come and bite me? And I said, well, you know, I'm fine. You know, so I tested and, you know, I was good to come back into the office and, you know, that sort of thing. But my immune system is so strong and always has been. Why are there people that don't seem to be able as stalwart? We just had a patient that passed away. This young man in his 40s, late 40s, with COVID, but he had some other comorbidities. But there's another piece of that. The hospitals refused to treat him properly and early enough, but that's a whole different story. But what's going on here?
Well, it's interesting because when I look at it from a Chinese medicine perspective, 3,000 years ago, they didn't have the applications we have now. They didn't have x-rays and labs, and they had to do it all by observations. And so they would kind of see how the person is responding. And you can tell by looking at the tongue, feel a pulse, even just by the mannerism that the person has, if they're feeling well. And you ask them questions every time they come in. How are you feeling? What's going on? Those can be better indicators than a lab test sometimes. However, they can be better indicators for people who are also too sick to be sick. They're the ones that never have a response. And so what happens is their immune system is kind of building everything up. So I get really interested in the people who say, I've never been sick for 30 years. Nothing's going to touch me. It's kind of like the people that come in and says, I can eat anything because my stomach is, hard as a rock, my stomach is steel. I'm going, there's probably some kind of compensation mechanism going on. And at the same time, with what we're currently dealing with, and we won't know this for a number of years, if ever, what are those pieces and those other things that are going on where is their body sick in other ways that they may or may not know about? Heart disease, asthma, allergies, digestive issues, even bone joint pain that causes more inflammation. Do they make them more susceptible for these people who get really, really tough to fight infections? Is it what makes things linger longer? Because like I said, the body's using up energy to fight this chronic infection instead of just dealing with the current one and moving on, kind of turning on and turning off. Now it's on automatic go. So what we need to do is be able to look at them slightly different and give someone ideas and treatments where they are in that particular situation, but we can't rule out the rest of their health at the same time. So you have to look at the immune system, but you have to look at everything else. And that's what's not being addressed when we just treat symptoms.
Dr. Stephanie, I'm going to ask you a question, but I want to remind everybody that this Wednesday evening, the 26th of the month, 7 p.m. at the Roselle Center for Healing, you're going to be doing a presentation on this subject. And, if you want to know how to keep your immune system strong and really be able to fight anything that comes down the pike, this is an opportunity that if I was in your position, I wouldn't miss, because I know things that you don't know, and this woman knows things that I don't know, and she'll be able to put that together for you in a format that you really absolutely can protect yourself. So here's the situation, Dr. Stephanie. When somebody has a symptom-free life, they really don't express anything. That really often can't correlate to them being well, because their body's ability to express itself optimally has really been retarded. Am I on the right direction with you with this?
Absolutely. I agree. I concur. Because when you think about it, you want to be able to turn on that immune system when you need to, but then dial it back as well too. So like I said, that common cold, that common flu, even a little bit of a stomach bug, as nasty as it can be in those very few days that you have to go through with it, it still tells you that something's happening. Your body's able to process it. I mean, we go back and forth with, the benefit of a fever. Is a fever good or bad? A fever is a normal process. It's turning up the heat inside the body to help get rid of whatever has just invaded it. So when we suppress it because we don't want it to be too high or it's going on too long, we kind of killing off our own body's ability to help it heal itself as well too. So there's pros and cons and things we can do. And the great thing is that sometimes it has to do with just doing stress management to make sure that the body can stay focused on what it needs to. And that's where things like Chinese medicine with acupuncture and herbs or looking at dietary and supplements as well too.
We're coming up to a break, and I want to remind our listeners that this Wednesday evening you're going to be presented. They need to call and reserve a seat. Also, go to my website, drtomroselle.com. And scroll down to the bottom. We have a lot of tools there that are available to you directly from manufacturers that are sponsors of the show that can assist you and help you keep your body strong. But this is an opportunity. This Wednesday evening is one that you shouldn't miss. We're coming up to a break. You're listening to Dr. Tom Roselle Live. My guest, Dr. Stephanie Pina. Don't go away. We'll be right back after some very important information.
Dr. Tom Roselle Live continues now on 105.9 FM, WMAL.
Welcome back, everybody. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live, as you do every Sunday, right? 12 noon, now that our football season is almost over, except for the playoffs. And we will continue at 12 o'clock throughout all of next year without having to be moved. Why? Because the Washington football team is going to our AM sister channel at 6:30 a.m. and join the rest of the sports programming that's there. So Dr. Tom Roselle Live will be at 12. Tell your friends, make sure that they know that we're in the right position, bringing them the most up-to-date data that we can possibly do on an ongoing basis. A program that we're doing today, or the program that we're doing today, is one that should concern all of us. And it has to do with our immunological responses. How do we protect ourselves from anything? How do some people seem to be resistant to anything that comes down the line? Doesn't make any difference what it is, and they live well, they live long, and so forth. Some people are faking it. I use that word that way, in that they don't seem to have symptoms, but they're really not well. They're not doing a good job at keeping their health index, their morbidity at a low enough level where, they're really enjoying it. They're putting it off. There's a fakeness that is about that. But there truly are. There's so many people that really haven't had sickness, and they've been able to fight through it. Fortunately, I'm one of them. I spend years not having any problems whatsoever. I don't take any medications. I don't have any. And, I'm in that ugliness, that seventh decade. Yeah, don't throw the stones at me, but we're there. But Dr. Stephanie, this Wednesday evening, you're going to go through this, but let's talk a little bit more about, why the susceptibility? What happens to us? Why do we get exposed to something? Sometimes we have to do it once or twice, but then we get nailed. We get nailed hard. Why is that immune system so tenuous and it's on a teeter-totter, so to speak? What happens?
Well, I think you kind of brought it up right there, is the fact that we are constantly dealing with stuff all the time. And whether we have control over it, like where we are, where we live, our social economic status, our current health status as far as, did we get our annual blood work done? Did we see our doctor? Did we actually go in or did we have to telehealth medicine it? We have to deal with all these different things. And so it's tougher now with what we're currently going through to make sure you're properly being seen, to help identify some of the issues that we don't think are a problem, to continue types of treatment that we need to kind of continue to make sure that we're getting both, I would say, even conventional care and looking at it from a holistic medicine care. What can we do to make sure our body is moving, that we're getting good nutrients, following up with those practitioners as well, too, dealing with stress management. We don't have the ability right now for everybody to do what we used to do. And so when that happens, it starts to put more and more stressors on our system, mentally, physiologically, biochemically. And when we don't take care of that, we can only go so long before the brake light or the engine light starts turning on. Right. And that's going to be different for every single person. And it'd be nice to say you get this symptom and that's it. And that's just not the case. We see this even with the current viral infection. Like, people come in with different things, and then there's symptoms that are like across the board. How they experience stuff, they're all different. So you have to treat each one of those people differently. You have to use different things at different times. So that means the person that comes in and you're working on preventative medicine and preventative health is going to be in a very different situation than someone who just acutely came down with a condition, or it's something's been lingering for a really long time. Yeah. So putting everybody in the nutshell, even with some of the best supplements and stuff we have out there that we've suggested, may not work from at different sections. So you have to be able to identify them. And unfortunately, when people are either afraid to come in to, say, the office, or they're afraid to talk to their practitioners, or the information just isn't available to them, yeah, it makes it more difficult to actually treat the current situation than, say, it was, 2, 3, 4, 5, 10 years ago. We had to deal with different things then, but we were able to experience it a little bit differently, get the help that the people needed.
We talk about health optimization and also the exposure and the degradation being around a triad. We talk about the structural pieces, and when we talk about structure, we talk about anything that you can touch, put your hands on, the muscles, the bones, the ligaments, even the nervous system. And we look at injury patterns, whether they're significant or they're minor, that impact that. The next piece is anything that's outside the body, exogenous, things that we're exposed to, things that we eat we shouldn't eat, things that we need more of, we don't get enough of. And the third piece is one that I don't think a lot of people appreciate. They give lip service to it, but in this environment today, I think it's more profound than any other time, and that's the emotion. That's how your mind works. It's not the biochemistry of the brain. It's the decision-making process that we go through, because your body will walk in tandem with whatever thought you say is true. So my question to you is simply this. I want to take that third side. I want to take that emotional piece. We're sitting there, we're listening to all these talking heads. They've done a wonderful job of scaring people across the board that, oh my God, you put your nose outside, you're going to die of whatever it is, right? And so, but they've had an underlying structural piece. They've had an underlying biochemical irritation. They're not eating the things that they should be eating. And even when they try, if they're not eating purely organic and free range and so forth, they're eating foods that have been hybridized. They're being foods that have been GMO modified. And those don't play well within the human physiology. You know, the argument is, well, we can feed more people that way. Well, you're going to cause more disease processes that way as well. So we have these other two things that we may have been limping along for a period of time dealing with, but now the emotional platform comes in, right? And
absolutely.
They fall, and they fall hard. Which one do you treat first?
I think you got to treat an aversion, all of them at the same time. So that's what I love about Chinese medicine. It does it all at the same time. You can use a point, a really basic point, and it will treat the mental, emotional, and structural all at the same time. That's why it's its own system. You know, it's set up to be its own system and address multiple things. And so that's the great thing. I don't say when we move blood flow, it's like going to the gym and walking out and going outside and getting a breath there, but you're still moving blood flow. So that's a great thing for people who can't do that. It's relaxing the body at the same time. So the stressor part's what's interesting, and I believe it was maybe towards the beginning of 2020 when we started doing our webinars because we couldn't do our in-house lecture. There was a great lecture that I listened to about a public health director that was up, I think, in Massachusetts, and I had a slide on it, and you can watch the webinars that were recorded all through that time off the website. And he was already talking about the mental, emotional effects and how it was going to affect chronic diseases and how they were using examples in the past, how they saw this. It was years after the events like 9/11, a couple of the tsunamis, Hurricane Katrina. And so it was years and years later, and they would see that chronic disease didn't get any better for those people. There was more mental, emotional strain on ages across the board. And you're seeing this now. And so there's some attention, I think, being brought to it, especially with the school kids and saying, how are they able to socialize if they are in masks?
Right.
Or
That's right.
How are they able to socialize if they can't get together with their friends and stuff as well, too. So you're still seeing that particular aspect, but it's the underlying mental, emotional issue. What is that child, person, adult still experiencing?
Absolutely.
And so it's going to be something that we'll be dealing with for a long time, well after COVID is gone, and becomes just a lab work to write up to see, oh, did you have an infection or not? But unfortunately, more and more people are looking for those types of treatment, and they're coming in because they feel off for whatever reason, and they just can't put their finger on it. And that's what I tend to see a lot. More people are coming in for acupuncture that are just saying, I just don't feel right. I just don't feel right. And so when I do that, we see physical things going on. But at the same time, I always say, no matter what we do as a treatment, we're going to work on your health, your mental health, your immune system, and also just making sure you're staying grounded during the whole thing. And potentially the talking heads are the part we have to kick out. Of course, not this radio show. We got to keep this talking head in.
Well, that's right. We only give you the truth. So
exactly.
That's why I'm in trouble all the time. That's why they knock me off of YouTube, and they don't like the things I'm saying, and I get slapped on the hand by other sources and so forth. And they say you have to be careful what you say. I said, have all the data in front of me. You want it? I'll send it to you. Here it is.
So the other stressors that
yes.
we need to eliminate or avoid those as much as we can, because you do see things when we have big events that happen, they become huge triggers and people will physically feel it. I mean, you go into fight-flight response. You're not You're not actually there at the time, but you're in that fight response. And so your survival mode is to get the heck out and do what you got to do, but you're not able to maintain that long term, and we try to. And then we're not able to keep our normal functioning and processing going like our immune system, because we have to have energy conserved to do that. So how do we do that? We try to relax. We try to avoid some of those things and kind of give our body what we need at the moment to help support it. So that way we can function better, because the stressors are probably not going to go anywhere, unfortunately, the outside stuff, but we can do it whatever we can to try to balance in the meantime.
It's like my grandson said the other day, and he said, Grandpa, he says, all of this is not going to go away, is it? I said, what are you talking about? He said, all the craziness. He's 15 years old. He's coming up 16 in about a month. And I said, unfortunately, I think that you're right on target. It's not going to go away. Because even if it was going to go away and we flipped it around and we upregulated all the emotional pieces to this, it's still going to take people quite a while to reset their vision emotionally. And what I brought that up for is that has such a huge impact on how the body reacts, because whatever you think is true and you accept as being possible and impactful and so forth, that's your decision-making process. Your body says, absolutely, that's true, and it changes its physiological expression to adapt to whatever that decision is. That's the problem. And we have to be very careful, and we have to watch ourselves, and to be able to constantly do things. There's a book that, that I've, when we have our docs meeting and so forth, I think you've heard me talk about it. There's an author by the name of Robin Sharma that I really like reading and listening to his stuff, and it's called the 5 o'clock Club. And it's, everybody who's successful at the highest levels possible, they always get up early, whether it's 5 o'clock or 6 o'clock, every morning, regardless of what it is. And they start their day in a very interesting way. The first thing they do is they get some exercise. Doesn't have to be a lot, just gentle, right? Just a little stretching. Some people like to run. I don't. Even in the days when I was in the best shape of ever, I would do HIIT training. I go out and sprint. That's it. I'm done. Or doing some light weights, or doing some yoga, or doing some Tai Chi, or something of that nature. Something that you like to do, 20 minutes only. And then 20 minutes either pray or meditate. Sit quietly and focus on what it is that you're trying to do and accomplish and optimize and maximize. And the third piece is learn a little something about about something that you have an interest in. Just setting the stage like that every day, getting yourself into that routine, not only optimizes the ability of your achievements in life, but it optimizes your body function and physiology. Am I on track on that?
You are. I laugh because my dog makes me part of the 5 o'clock club. We have to get up and walk her every single morning. And I get my exercise in for 20 minutes, and then I get my 5 o'clock in, and then I think about what the heck I got to do afterwards, and then she's set to go for the rest of the day. So pets help the immune system. So,
there you go.
And mental. But, I tell my patients,
so the takeaway is that everybody needs to go out and get a dog and get the rescues, because they're the ones that really need us.
There you go. Mine's is my audience right now for this radio show. And if you see the audio of this, if we put it up there, you might see her jumping in and out. So, but one of the things is we do have to find something to kind of balance out the negativity, the emotional stuff. So when I have people come into the office and they're getting an acupuncture session, I always say to myself, this might be the only 25 minutes that they actually have for themselves to work on themselves. And then I try to do things I can always tell when they're thinking about the shopping list or the laundry list or what they have to do next, or they're running back to work. I try to give them something to think about outside of that, even if it's our music or something, or the warmth of the bed or something, create that healing environment so you get 25 minutes for yourself that you may not get as you run around the rest of it. I can't tell you how many parents come in and they say, well, I'm up till 11, 12 o'clock at night, even though I'm tired at 8 or 9 because I have to put my kids to bed and deal with all their stuff. And that might be the last 2 hours of the day that I can get my stuff done. That's going to work for a while. But at the same time, if they had that chance to not have the other things that they had to do, they'd probably be feeling better if they could get that rest and boost their immune system as well. So.
Knowing how the mind, and we're not talking about the brain, and this is something that I want to make sure that our audience really appreciates. It's the mind how we make decisions. We know that in today's world, if we look into the world of epigenetics, we say that your cellular structure, your DNA, is an expression of your environment. That's what epigenetic patterns are. It's the food that you eat, the environment that you're exposed to, the mental thought process. If you think you can, you can. If you think you can't, you're absolutely right. And that's who we become. And when we know that and we can measure it and we look at longevity with these little tails called telomeres that sit on top of our DNA that can be expanded, they can be lengthened, and our life patterns can be, but we have almost 98.5% junk DNA. What that really means is dormant DNA. It's sitting there and it will only express itself, and some of it's really good and some of it is something that we don't want to, open up. But based on environmental impact, this is what we're seeing. And this is your world. This is, when you're dealing with the body, here's what I tell patients, and then I'm going to let you comment on it because it's important, is that, you're a physiological being. Everything you can touch, that's broken down into organ systems and cells and molecules and then atoms. And then after that, it's wavelength. It's photon. And every structure in the world is like that. Your ability to look at life, meaning your medicine, is really dealing with that energetic platform, that photon, which immediately affects everything else and strengthens it up from epigenetics and from energetics, correct?
Yeah, it's no matter how you want to look at it, there's a physical change happening, whether it's acupuncture, herbs, diet, something, the body is assimilating something and it's able to create another function or physiological change. And so when you look at it, we don't think in terms all the times of energetics because it's not something that some people feel comfortable with, right? So what tends to happen is I start to go, okay, if your energy had to move your blood flow, if your nutrients had to get into your blood vessels and go to where you take the perfect supplement or the perfect herb and you got to get it to its place where it needs to go. But first you got to take it and digest it. You need energy, ATP from a biological standpoint to get it there. So let's harness that. And so what's crazy is you think about some of the things that herbal medicine has been doing, and they've been combining ideas that how do we improve energy in our formulas? And how do we use herbs like adaptogens to kind of help us deal with stress? How do we put herbs like nervines and relaxants in the body to deal with the mental, emotional side? And so you see this kind of increase. And so it's like an immune system formula is not just immune herbs anymore. It's not just get rid of the cough and get rid of the phlegm and treat the symptoms and stuff. It has to deal with the rest of the body. So you can't take that out. So whether we want to label it as energetics or we want to label it as the mind-body connection, we got to find our place where we're comfortable with it, but it's definitely connected together. So, and this is why I think you see more people getting interested in natural, treatments and natural
how to fix
supplements, everything, because they're missing that piece.
We're coming up to a break, Dr. Stephanie, but, I'm excited because of the way we approach things. I have so much admiration for your bandwidth and what you know and what you bring to the table. This Wednesday evening, our listeners are going to be able to appreciate that and get that firsthand. We're coming up to a break. When we come back, we're going to talk a little bit more about what you can appreciate from this woman, from this amazing doctor who's been with me a long time. Don't go away. You're listening to Dr. Tom Roselle Live.
Dr. Tom Roselle Live continues now on 105.9 FM, WMAL.
Welcome back, everybody. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live, as you will be doing from this point forward every Sunday at high noon, 12 o'clock on the Eastern Seaboard. Those of you who are on the other part of the country, we've tried to let you know that we've shifted just a little bit, but there's enough promotion going on that you should hear about it. We've reached out to our audience, our patient base, to let them know. But tell everybody that we're here, because this is a program that will give you information that you're not going to get anywhere else. This is one that gives you the truth, the details about things, but more importantly, gives you the tools of how to handle things so you can live that not only symptom-free life, but a life that has the capacity to really unfold in ways that you could only hope for or dream of, but it's really all yours. It's in your hands. And that's our goal, is to give you as much data, as much information as we possibly can. And as always, we want to thank our men and women in service and in uniform, because without you, we would be in a really bad place and not be able to bring you this type of information and to be able to express thought processes that really will help you, your family, and so forth. And my guest today, Dr. Stephanie Pina, she'll be your host at the Roselle Center for Healing in Fairfax this coming Wednesday night, the 26th, 7 p.m. I promise you, you're going to walk away with tools that will be able to help you handle all this craziness that's out there. Now we have, even if they say all the mandates are gone in the middle of the spring and so forth, and there's a little bit of viral patterns out there, we have to reset the emotional platform. We have to get back to a thought process of normal. Let us give you that information this Wednesday evening, 7 p.m. at the Roselle Center for Healing in Fairfax. All you have to do is call 703-698-7117, register, or go online at rosellecare.com, and we'll see you there. I promise you. For those of you who've never been to our practice, this is a big old reception area that has separation and filters, and you're perfectly safe. I promise you, you're going to be fine. And, we'll look forward to seeing you there. Dr. Stephanie, this is a program really that if we wanted to break it up into different pieces of the puzzle, meaning organ systems and different immunological responses, we'd be here for 4 or 5 days. But what I'd like to do and put it on your shoulders now, what are you going to be doing Wednesday evening? What kind of expectation can our listeners have if they join you? And I encourage them to join you because they're going to be totally amazed. Kind of lay that out for us a little bit.
Well, one of the things we want to do is stop looking at the immune system as just these little, subcategories and variants, and we want to start looking at it from a different perspective, that it has to do with everything we do every single day. And so in order to really deal with immune issues, we have to optimize our overall health. So first we're going to address that. Then we're going to optimize it by figuring out what can we do at the certain time. So looking at it from a preventive medicine standpoint, what happens when someone has acute issues going on and chronic issues and something keeps lingering. If we look at those differently, we can use different types of modalities and treatments more effectively instead of just throwing everything at it at the same time. There's a time where you got to treat one thing at a time instead of 100 things at a time. So kind of looking at it from there. And that's where I think Chinese medicine, especially acupuncture and herbal medicine, really shines through, because you can alter it and it's not based off of you're going to be on something for millions of months. You're going to be on it for a short period of time and then it changes and we change with it. So that's really kind of where I'm going to gear some of the treatment talks, because essentially you have to be able to treat the person where they are at that day, that stage of their illness.
That's right.
So understanding this is not something that we get taught in conventional medicine. It's just, you're going to take this and you're going to take it until you're better and then that's it. But what if you're not better? So we're going to look at it from more of a holistic standpoint, and just even understanding those basic ideas gives us stuff to do, because there's sometimes people out there that they have to get stuff done because of a mandate or because their schools are requiring it. What do they do in the meantime? They can optimize their health. They can do certain things that basically put them in the best possible place that they possibly can be at. And that's what we have to put forward, instead of saying, here's the new drug or new supplement of the day, because that in itself may only help a certain amount of people. And it may also depend a lot on dosing and where they get it. And so there's a lot of different things that you have to work with the practitioner on a daily basis.
I was talking to a friend the other day, a very dear friend of mine. He's a physician, a medical physician. He does functional medicine protocols and so forth. So he has a tremendous affinity for the world that you and I are in. And we got to talking, and we were talking about things like thyroid function. And I got into the HPA axis, which is hypothalamus, pituitary, adrenal, and how it affects thyroid. And if those things aren't working, I was going through the chemistry, sitting there thinking that he fully understood what I was talking about. And he did about 75% of it. And then he said, do you know that my colleagues, and this is a guy who's in his 50s, have no clue what you just said? And my brain went, did they take the biochemistry courses? He said, yes, but they're never told how to apply it. And they go in and they said, if you have these symptom process, take this medication. So I say that simply. This is somebody who I respect and who respects our work, and we go in an exchange constantly. Very bright man, very, very excellent doctor. And, so when a patient comes in, for example, somebody who's on metformin to try to bring down their blood sugar levels, and you ask the question, did your doctor put you on B12? And they look at you and say, why would they put me on B12? Because metformin is a drug that dramatically lowers the levels of vitamin B12 in your body and all the other cellular components. But here you are looking at the body at an energetic platform and a basis of, we have to make sure that things are stable. And, oh, by the way, you can't take the same thing forever. You have to tweak and change and move. And even when it comes to homeopathics and it comes to herbal preparations and adaptogenics, as you talked about in the first part of the program, they're there for a purpose. And you want to make sure that we use it from a purpose of no harm, which we all took that oath, primum non nocere, first do no harm. But there's a place where you have to reevaluate. It's not meant to be there forever, correct?
And also with your B12 metformin example, what does B12 do that now is missing in the body because they've been on metformin without it for so long? What do we have to pick up as symptoms that are kind of the secondary effects as well too? And that's where having that mixture between understanding how conventional medicine and holistic medicine works, but thinking outside of the box in order to come up with the best treatment plan. Put the B12 back in. What did it do when it wasn't there? So, yeah, we've got to look at that from the immune system standpoint and for overall health as well.
This has been a fun, fascinating program to do with you simply because of your knowledge base and everything that you've had and you bring to the table. But this Wednesday evening, Dr. Stephanie will be your host, your presenter. Please join us. I promise you're going to walk away with so much data. Give us a call, 703-698-7117, or go to rosellecare.com and register online. We'll be back next week with more information and things that you can't do without. And I mean that seriously. And remember that we do this program for one reason and for one reason only. We love you. See you next week. Bye.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
This is Dr. Tom Roselle Live on 105.9 FM WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. Indeed, we have some amazing programs for you, and let me tell you, this is one of them I think there's going to be a tremendous amount of interest in, and simply because, we want to keep you upright. We want to keep you walking. We want to give you the opportunity to be able to avoid surgical intervention and drugs and steroids and painkillers when, it's at all possible. And we're going to be talking about actually an all too common situation. And we're talking about hip and knee pain and degeneration and how you can avoid surgery. And as many of you have gone to your physician and said, well, you need a total hip, you need a knee replacement. Well, we'll watch it for right now. We'll just, shoot you up with steroids until it gets to the place where you can't handle it anymore, and then we'll take the next step. Well, maybe there's a better way. And we're going to discuss that with somebody who I have tremendous amount of respect for, Dr. Scott Lamb. Scott, welcome to the program. And this is something that, the Roselle Center sees so much of, unfortunately, on an ongoing basis. And hip and knee, but we see other joint spaces as well. But I want to focus in on this because this is something that affects so many people across the board, and at one point they get to the place, I can't take it anymore because it's never been approached properly, and guess what happens? Now they have no other alternative except for surgery. So let's get into it. And again, welcome to the program. Good morning.
Next time. Yeah.
This is the first time we're at 12 noon in a long time. We've shifted, and you're the initiator. Well, what better, right? So we're going to be on 12. We're going to be on 12 o'clock noon every Sunday from this point forward, since the Washington football team now will be on the sister channel on AM 630 on an ongoing basis. So this is free, and we're ready to go. And those people who have not been able to hear us live for a long time, who are in church or have other things going on at that time frame, now can listen in. So it's going to be good. Scott, awesome. Dr. Scott, let's start with this. Relative to incidence, relative to hip and knee pain, What's the guesstimate of how many people truly really suffer from this at one point or the other through their life, and what's kind of the age bracket that you begin to see this stuff?
Well, I mean, overall arthritis, I think everybody's probably going to be suffering to some extent of arthritis, depending on, again, how well they take care of themselves. Some of the statistics is 1 out of 4, but I think when you start looking at about 25, 30 years of age, you start seeing things start breaking down depending on the type of, exposures they have, diet and all those kind of things that play a part, and things start adding up after a period of time. And a lot has to do with, I think, not only just the structural part, the chemical part. When we start altering blood flow, when we start seeing even arteriosclerosis happening, where that means it's the plaquing that happens, the blood gets altered, and that doesn't affect the joints very well when that happens. And we've been seeing that since the possibility have been hints of that even back when 20s or even late teens with bad diets. So it starts early. The repercussions of it are shown when you get into your 40s, 30s, and 40s. It's there, and we all can be very much susceptible to it.
So here's the situation. You have a lot of different triggering mechanisms. One of them is, when it comes to the hip, is a shallow socket. And a lot of athletes will say, when they do push-pull work with their legs, they hear the hip popping, or one side popping and not the other side. And you take an x-ray of it, you see that the portion that goes into the pelvis itself, not the leg bone itself, is flatter. And I'll use that term so people can have a better understanding of it, than the opposite side. So that femur head, if you will, the end point of that leg that sits in that socket, is not sitting properly, and you get snap, 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 snap. And then we have, people with too much weight on their body, obviously, and it's going to put pressure on their hips and knees. And we have people who are athletes, and you wonder how can a guy that can squat 600, 700, 800 pounds not break their joints down? Well, there's a lot of different mechanisms, but let's get into the predispositions leading up to somebody who, we start seeing surgical intervention in 30s, but very significantly, above 60. And there's many different types of problems. So what we want to talk about is, one, is it preventable? Is it preventable every time? Or are some people just destined, to ultimately just put it off as long as we can, and then we'll really, we'll have to do some surgical intervention. So let's explore that. There's a lot of natural ways of making this happen. So, Scott, in your opinion, when somebody comes in and they have hip pain and they have knee pain, is the majority of time, is it a cascade of osteoarthritis and degeneration that takes place, or is it other mechanical features that kind of present first?
I think it's probably a great deal. Those things are great. Other mechanical features that play a part. When I had my training in the CCSP, I mean, one of the things we talked about, which is a certified chiropractic sports physician, the knee and the hips, the knee especially, 80% of the time was not from the knee directly. It was from how are they working with the foot, the arch of the foot. If the arch of the foot wasn't holding or supporting well, you have rotational factors that happen where the foot might drop, rotates the knee in, and also the knee's taking this extra irritation. And you got to think about how many steps we take a day. Over time, we're walking over 1 million steps a day. If you're looking at 3,000 steps on a daily basis, you're over 1 million for the year. And so how many times do you put that into an abnormal position, and the torque that happens, and you have torque and friction and things like that. And then you got, what's my dietary element? I mean, how well am I eating things so I can recuperate and I can rebuild something, or I can help take away, we're going to talk during the talk a little bit about proteolytic enzymes and how they break away some of these, some scar tissue that forms up, and how often we do the scar tissue forms, and all of a sudden the same thing at the hip and then the knee, all of a sudden things start falling apart. So you can start seeing things, starting from the feet, from the foundation up, or even sometimes from the hip down. You can start seeing things like on the knee and the hip, going from things that are distorted. I think one of the most important things for overall health, especially when we're getting in our 60s, is our pelvis being balanced. Is the pelvis level? If not, if it's torqued, then the whole system from the hip to the knee to the leg, one leg is shorter, one leg is longer. I've got a twist of my back to some extent. I've got additional pressures that are put on my lumbar spine. It starts in an early stage, unless you have a traumatic type thing. Somebody gets a hip pointer in football or gets hit pretty strongly. Something usually predates that's caused that problem.
You talked about a hip pointer in football. It could be any sport where there's trauma to the joint space. One of the things that occurs and has happened to many athletes is called avascular necrosis, where the blood supply to that joint has been damaged, and now the joint begins to break down. That's rare. That happens, but it's not something that you see on a regular basis. Interestingly, and you brought it up, kind of indirectly, people walk strangely. And, there's a very dear friend of mine, Dr. David Lee, one of his favorite songs is by The Doors back in the day, and it's called People Are Strange. And you watch them walk, and as we do, we have people walking up and down the hallway in our practice. We watch them walk, but, they walk like a platypus duck. The feet are to the outside. That tells you that the mechanical relationships of muscles to joint spaces aren't firing, or they walk like a penguin. The feet are internally rotated. Or you watch them walk and you see that there's one hip that is higher. That's a mechanical stress pattern that is causing an exaggeration on the structural components of the hip and knee. Subsequently, if it's not corrected, if things aren't dealt with appropriately, now you're going to have joint spaces that are going to wear and tear. They're going to break down because the muscles aren't firing properly. And it can be from anywhere in the spine. And as you talked about, from the feet up. If the feet aren't working the way they're supposed to, if the arches are dropped and you have multiple arches within your foot that have to be supported, then the mechanics from that area up are not going to hold properly. So one thing that I would tell our listeners is, if you have a partner at the house, have them watch you walk, and your feet should be straight in front of you. Your stride should be equal one side to the other. And if it's not, that tells you got a mechanical problem that ultimately could cause a wear and tear issue on the knee or on the hip. Am I going in the direction?
And I think one of the things is that, you take a look at how often we do sometimes have people walking down. I usually put a tongue depressor between their teeth and have them walk, and they feel like they walk better. It's so much amazing when you're talking about input from other parts of the area of the body, or things are being turned off and the body's not aware. It's interesting. A lot of times we have a tendency when we're looking at problems on the body, we're looking for the tight muscle being the problem. And it's usually not the tight muscle. It's usually the muscle that's turned off due to some type of injury and it never returned back on again. And this is kind of uniquely good for what we do in our practice, is that we got to make sure that the whole system's working. Even the jaw can throw the hip out to some extent. I don't know how many times, and you probably see it, probably about 25% of the time in the office, when somebody has something off, I check a jaw pattern, and all of a sudden it's like, all of a sudden the hip is better. It's an amazing combination where there's interplay between the body in so many different ways, and then something's not working right, a muscle will turn off, another muscle will tighten up to try to take out the load, and all of a sudden now you got this imbalance that goes through the whole system.
And mechanically, people don't understand that. When I talk about people, it's not just the patient, obviously, because they're not trained to observe those things. But even physicians who are supposed to be in the neuromuscular game, your right shoulder and your left hip work together. Your right wrist and your left ankle work together. So you have these joint spaces that fire in a synchronous pattern, an orchestration, if you will. And sometimes we end up with a knee problem on one side of the body, and the problem is really the elbow on the opposite side, and the muscles have been misfiring. Now the body adapts mechanically and try to put up with it and deal with, and now you have the wear and tear and the irritation and the breakdown that is subtle over a period of time. Then you add that perhaps to excess weight. Every pound that you have around your belly that's not tight and too much is 4 pounds on your joint spaces down low, particularly your knee. So you end up with this ongoing irritation that is a wear and tear. My guest today in studio is Dr. Scott Lamp, one of our docs at the Roselle Center, who I have tremendous admiration for, and his ability to look at the structural components of the body and really see what's there. Scott is a certified sports physician, and so he sees these things ongoing. You have an opportunity this coming Wednesday evening, the 19th. Gosh, we're already at the 19th of 2022. This is nuts. It's going by so fast. I'm feeling old by the moment. And you can have the ability to come at the Roselle Center for Healing, and we're in a very safe environment. We have HEPA filters all around. We clean this place and scrub it down like nobody's building. So join us, and all you have to do is go online at rosellecare.com. You can register online, and we'll give you a call back to confirm your reservation, or simply call 703-698-7117. We're coming up to a break, and we'll continue the conversation after we come back. You're listening to Dr. Tom Roselle Live. We're bringing you information that you can apply immediately right now, tomorrow, and, hopefully get you out of this knee and hip pain and save you the intervention of surgery. And we'll talk about that a little bit as we come into the second part of the program. Don't go away. We'll be right back after some very important messages.
Dr. Tom Roselle Live continues now on 105.9 FM WMAL.
Welcome back, everybody. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live, indeed, as you do every Sunday on the channel that you're listening to, 105.9 WMAL. And, we're excited to present a program that way too many people have to deal with, and we're going to try to give you the opportunity to fix it. What are we talking about? We're talking about hip and knee pain problems, and the ones that your doctor says, well, it's just a matter of time, but we're going to have to do surgical intervention. What if there was another way? What if we could do something that would not only put it off for a long time and give you your life back, but prevent it from ever happening? Is it possible? In many cases, it's very possible. This Wednesday evening at the Roselle Center for Healing, the 19th of January, Dr. Scott Lamp, one of our best and brightest, particularly when it comes to joint space dysfunction, will be presenting. And Scott is my guest today on Dr. Tom Roselle Live, and this is what we're talking about. Dr. Scott, welcome back. We'll have a short segment here, so let's get into just a little bit relative to the mechanics of it. Does the knee problem come first, or does the hip problem come first when it comes to pain and degeneration and breakdown and so forth?
Take your pick. I think, like we were talking about before, what's the first one that I think the thing is like, what is the first initial injury, and has that been taken care of completely? The body likes to adapt a lot, and when it adapts, it actually adapts for the purpose of survival. If I'm going to hurt myself, I roll my ankle, I'm going to maybe put a little bit more pressure on my gastroc muscles to hold that, where my muscles on the other lateral stability muscles are not quite there. And so they adapt and they never go back to where they were properly. So who knows? Now, it could be from an injury from a car accident. It could be a slip and fall. I do a twist on my knee or a twist on my hip. And again, the fulcrum of the knee is actually in between the hip and the ankle anyway. So you're going to have anything that happens there that happens down to the ankle is going to actually put a twist on that knee. So many factors play into this, Tom. And I think, again, when we talk about our triad of health, of structure, chemistry, and emotion, the other part of this is how well are we getting blood flow to these areas, away from the biomechanical type things. The blood flow really makes a major part here. And if some of those are being altered or actually even adding body weight from, like you're talking about, too much weight on the body is going to create some big problems. And, like when we run, it's 3 times your body weight. Well, certain parts of our body take up to 7 to 8 times our body weight. The pivoting of the gastroc or the Achilles tendon can sometimes take 7 to 8 times your body weight when you run appropriately. And if you're running inappropriately and you got those pressures on you, it's going to create some problems.
So, here's what you brought up: running. Everybody wants to go out and jog and run and so forth. And, you reach a certain place in life And running isn't what it's all cranked up to be. And it's not something that you should go out and just do for a lot of reasons. One, cardiovascular, and we could talk about that on another program. But the other piece is your joint spaces, because now you've got the wear and tear of sometimes inattention, if you will. You haven't taken care of yourself. Yeah. You haven't strengthened your core. But you get out there and you start hammering those joints, and you have an inflammatory reaction. You have something that has been sitting there quietly, and I'm going to use the term eating you for a long period of time. It could be a viral pattern. You know, we're talking about viruses today and all these crazy different things that have come down that are the cousins of, you know, what we started 2 years ago. But there are other viruses as well. There's Epstein-Barr viruses. There's other types of coronaviruses. And these things have a habit of getting into the joint spaces and sitting there. And these cause an inflammatory cascade, an inflammatory reaction that causes the joint to be irritated and begin to break down. And
I think some of these, it's like some of these things, like we talk about autoimmune diseases too, like rheumatoid arthritis, scleroderma, some of these things that lupus that are in this, that autoimmune that's supposed to be an unhidden cause, some of them are thought to be associated with viruses because viruses get inside the cellular structure or inside the cell and get hidden, and the body tries to find it, so it just attacks that whole system. I mean, we've got some of these things that, again, there's so many different pieces at play here. I think the big thing with arthritis is, can we keep our joint space? You lose the joint space and you got bone on bone. It's really hard to work with when you get into those circumstances. Even if you bring in regenerative medicines and things like that, joint on joint, it's really, really hard to work with.
It is. It's a challenge. What I want to do is I want to get into exactly that topic, and can things be restored when we come back into the second part of the program. This is a fascinating subject. My body has been beaten up over a period of years, and from playing ball in college and martial arts and multiple accidents, and 45 years coming up in April treating patients. So it becomes much more of a challenge. This Wednesday evening, the 19th, Dr. Scott will be your presenter at the Roselle Center for Healing. Don't go away. We'll tell you more about that when we come back right after some extremely important information. Stay where you are.
This is Dr. Tom Roselle Live on WMAL.
Welcome back to Dr. Tom Roselle Live. Indeed, we have a really interesting program today, one that we're going to try to save you some money, but more importantly, we're going to try to save you pain and the chronic devastation of having to put up with something. What are we talking about? We're talking about back pain and its ability to be chronic and never go away. But in this part of the program, we're going to tell you what's going on. We talked about its surgical failures, if you will. So, if your doctor's talking to you about you have to have surgical intervention, you better stop and think a little bit before you decide to do that, because surgery has about a 50% failure rate when you look at it. The American Journal of Medicine observed in the United States that there's 80,000 spine surgeries that fail annually. 80,000 that fail. That's incredible. Do the math. 80,000 times a minimum $70,000 each, and they're failures. That means that you go into the surgery and you don't come out any better than what it was. So about 1 in 5 patients who undergo spinal surgery for a degenerative disorder ends up returning for a revision procedure, a second operation. And as we said early on, your chances of that second operation working are very, very minimal. You have a 30% chance of success with the second surgery. And if they talk you into a third surgery, it goes down to 15%. And God forbid you have another one, you have a 5% chance of something becoming positive for you. I don't know about you, but the odds are like crazy. So, there's a 50% chance after you have surgery that you're still going to have a lot of pain. Why would you take that risk? I've been in the business now over 44 years, and we see post-surgical devastations. We see people that come into us, and fortunately they've chosen to get conservative care before they do anything else. And the rate of success when you choose to do something other than, but you become proactive, and we're going to talk about what that means for you, what you have to do in addition to having us do something to you, if you combine the two, it's quite significant. You turn your life around. So let's get away from the failure of low back surgical intervention, and let's look at the conservative pieces. We have a country today where people are very sedentary. We have our iPhones, and we have our computers, and we have our iPads, and we're sitting all the time. We get in the car, we go from the house to wherever it is that we're going. We park as close as we can. We don't eat the way we're supposed to. Just take a look around you and see the size of people. That all by itself tells you that we're not moving, we're not exercising, and we're probably putting the wrong fuel in our body because the body doesn't want to use it, so it goes into storage. See, that's what happens, right? You have to have so much energy. Body converts foods into sugar. But if you don't convert it and use it, the body says, okay, well, I'll put it away for a rainy day, and that rainy day becomes those extra pounds that we have stored in a lot of different places in our body. Well, not a good thing, because now it puts extra stress and strain on every joint space that you can possibly think of. So when you're dealing with that increased load, if you will, that increased biochemical stress, the inflammatory reactions that can take place, you're causing yourself undue impairment that can lead to a place of debilitation and back pain. So do a gut check, okay? Think about, am I eating the way I'm supposed to? Am I getting out and doing anything relative to exercise and the like? So let's talk about, you've gone to a place, you got back pain, and you've been told, well, take these pills, and when those fail, we'll do some surgical intervention. So over 44 and a half years of treating all kinds of pain, chronic pains, debilitating pains, other health conditions, metabolic disorders, and so forth, the one thing that I know is true is that your chances of resolving a problem, if you work as a partner with your doctor, meaning your natural care doctor, your chiropractor, your osteopath, and PT when it's necessary, you can resolve the greatest majority of situations. Just because your x-rays and your MRIs show that you have degenerative diseases or you have a bulging disc does not necessarily mean, in most cases it doesn't, that that's where the pain is coming from. In our office, we use spinal decompression. Non-surgical, non-invasive, not hurtful, a way of causing suction within the disc space to be able to increase circulatory pattern, opening up the gliding points, we call them facets in the back of the spine, and causing almost a suction to begin to pull that gel, which is a whole lot like toothpaste inside that disc space, back in, and do it frequently enough with nutritional guidance and so forth to allow it to begin to not only resolve the pain pattern, but to heal. And then when you couple that with low energy light laser and acupuncture, but the last piece, even if we get you out of pain, even if we get you, and the chances are that we're going to be able to do that and do it successfully, even if we're able to do that successfully, there's another piece that you have to become proactive in. And that other piece has to do with exercise. How many of you even get up and walk on a day-to-day basis? If you've listened to Dr. Tom Roselle live over a period of many years, you've heard me say numerous times that if you didn't do anything else, get outside and walk 2 miles a day. Now, I'm not telling you how fast to walk. I'm not telling you have to walk it all at one time. I'm just saying go out and walk 2 miles. You can put a headset on and go for a walk after dinner. You can do it in the morning when you first get up. Go walk 2 miles. What would that do for you by itself? Well, number one, it decreases your risk. If you did it every day, it decreases your risk of dying of a disease process, a pathology, by 50%. That's what the odds are. That's what it shows you. That's what the research is. You decrease your risk of dying of a disease by 50%. When we talk about disease, we're talking about diabetes, we're talking about heart disease, we're talking about kidney problems, we're talking about metabolic disorders. You drop it by 50%, and you get locomotion, you get movement. Life is motion. You have motion, you increase your life. So we want to produce positive effects and be able to get metabolites to begin to move outside of our body. There was a study that showed that participants were evaluated on how exercise affected their metabolism. Interesting, right? So we're talking about metabolism, but we're still talking about pain and low back problems. The researchers that did the study discovered that short bursts of intense exercise produce extremely positive effects to get rid of these lousy metabolites, if you will, that are associated with cardiovascular health and long-term health outcomes. Those people that engaged in vigorous exercise also had a much lower risk of all-cause mortality. Interesting, right? Compared to those who are moderately active, meaning 2-3 days a week and so forth, and compared to other studies. So, let's talk about that. And what does that mean for your back pain? I don't want you to go out and start running like a crazy person if you've got back pain or if you have neck and shoulder pain. You have to start someplace. Where do you start? You start by doing things like walking and stretching and watching what goes in between those lips of yours so your body's not packing on the extra load that you got to carry around that your body has to stress itself over, right? So remember my old cliche, avoid sugar, sodas, coffee, black teas, fast food, fried foods, alcohol, gluten, additives, preservatives, GMO foods and gluten products and so forth. Those are things that we have to be very, very careful of. And in today's world, particularly the GMO and the organic foods, if you're not doing that, you're getting all kinds of poisons in your body and your inflammatory levels go up and they have a tendency to accumulate. One of the things that we're finding also when it comes to joint pain and back pain is the accumulation of something called oxalates. Now, oxalates are these little crystalline formations similar to, but not the same thing as uric acid in somebody who has gout, and they get into joints. And if you're not moving, your body can't metabolize them. You're not drinking enough water. You can't push these things out. And these oxalates can cause crystal formations within the kidneys and other areas, but we're finding that they get into joint spaces, and it's not okay. So we have to make sure that we exercise. So you start with stretching. You start with doing things that are low impactful, but you start doing them every day and you start getting your butt out and start walking. When I lecture to doctors around the world, we talk about, and I'm going to steal the term from a lecturer, a motivator, a guy by the name of Robin Sharma, and there's this thing called the 5 o'clock club. And that means that the most powerful and productive and successful people in the world get up at 5 o'clock in the morning before the rest of us even are opening our eyes. And you can move that 5 o'clock club to 6 o'clock. So what do? Why do they get up so early? Because they find that their most productive period of the time is in the morning. So they get up, and the first thing that they do, whether it's 15 minutes or 20 minutes, is they exercise. And they exercise over that period of time intensely because you don't need a lot of time to exercise, but you have to do something. Some of them get out and they put, 2 pounds in each hand and they go for a very brisk walk and they get their heart rate up and they're pushing for intermittent firing of the body's cardiovascular system and so forth. So they're going to walk real fast for a couple, 2-3 minutes and they slow the pace down. They walk real fast and then they do some stretching and so forth. And that's their exercise. Some people do yoga. And then they get into a focused state of either meditation or prayer. And they focus on what they want to do. And they actually thank their body and see their body begin to repair itself. Interesting in this, and I'm not trying to get into a metaphysical place with you at all, is that your body responds to the direction that you tell it to go. So whatever your mind says, your body follows through with. So it'll say, for example, let's go back to, a guy by the name of Henry Ford. He said, if you think you can, you can. If you think you can't, you're right. So if you tell your body it's going to heal, you visualize the healing process, you visualize your body getting better, without doubt, it takes a huge step in that direction. And every research pattern that's been done on those types of interventions show that that's true. But if you say, oh, I'm going to die, I'm getting worse, and, when somebody says, how you doing? Well, life isn't as good as it should be. Guess what happens? Your body says, okay, I guess that's what we're supposed to be doing as well. But we want to make sure that we exercise, and you have to start someplace. So if you don't know what to do, the first thing that I would do, and there's so many things that are available online today, from very gentle basic yoga and Pilates and stretching and things of that nature, and you can look at, see which one fits you the best. But some of us need an encouragement of having somebody kind of keep us responsible. We need a trainer. Go to the gym. Go to, there's so many different places out there, and say, hey, I need somebody to help me begin to strengthen my body and get me to move a little bit. If you haven't been moving for years and you got a few extra pounds around, it's not going to be easy for you to get going, and it's going to be much more motivating for you just to sit still and doing nothing. But the benefits of using a trainer, or even getting somebody to work out with, get a friend, let's go walk, work, and we can all do it. When you go to the office, instead of parking up front, park in the back and walk to the office, or walk to the grocery store, and park at the end of the parking lot, or, do those things, but get somebody maybe to help you with that, so you hold each other responsible. Years ago, I used to be the on-the-road doc, if you will, by the guy by the name of Tony Robbins. And, something that I learned from him was very profound, and we're going back years and years ago. He said, never leave the site of a decision, if you will, without taking an action step towards it. So if you decide after the program today that you're actually going to do something about your health and your wellness, and you're really going to make a decision that, I've been in too much pain for too long. I've got to do something about it. Obviously, the drugs aren't working anymore. Get somebody who will hold you responsible. Get somebody who will, be not only your encourager, but somebody that's going to move you forward. Pick up that phone and say, hey, Pete, hey, Mary, listen, I know that you're going to give me a hard time if I say I'm going to do something, I'm not going to do it. But more importantly, would you do it with me? Can we do something together? Can we go out and have that and walk every day? Europeans and other parts of the world have a much greater health index than the United States of America, and we have all the resources around us. Why do they do that? Well, they walk everywhere, and they get into social interactions, and they do things that we don't do. So why don't we change something? Why don't we get off our derrieres and begin to do things that will be supportive of that? Let's get out of the slump. Let's do something that perhaps we didn't do it. In that back pain that you have over a 50% failure rate with, guess what? You may not have to go that. But spinal decompression with any kind of back pain, whether it's neck pain or low back pain, works extremely well. And it's not invasive. It's not going to cut you. And your chances of resolution are extremely high. But when you combine the two and you add the dietary piece to it, you've got something that is extraordinary. And in my experience, after 44 and a half years of practice, bears that out. We see patients who have horrible pain patterns that resolve themselves. And if you want to talk to one of the guys at Roselle Center for Healing, just go online and find it and make it happen. And we'll be more than happy to tell you exactly what it takes, what needs to be done. But your responsibilities, by the way, to becoming part of the process. We're coming up to a break, and I hope, if nothing else today, you have an idea that you can do something differently. But don't go away. I have much more for you. I'll be right back after some very important messages.
This is Dr. Tom Roselle Live on 105.9 FM WMAL.
Welcome back, everybody. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live, as you do every Sunday on the Eastern Seaboard at 11 a.m. Those of you who are at different parts of the country, first we thank you, but you know what the drill is, you know the time. And as always, we so appreciate our men and women in the military, and you reach out to us, and we always try to get back to you as best that we possibly can. Know that we're here for you, and all you have to do is, send me a note, and I try to answer myself because I love you guys and everything that you've done for us. So, go to drtomroselle.com or go to rosellecare.com, and I will get back to you as rapidly as I possibly can and give you my opinions that will help you in your search for data. wanted to remind you all that we're back in office now doing our in-house continuing education programs every other Wednesday evening, and you'll hear it advertised here, but you also will see the different classes that we offer at rosellecare.com. Don't forget to check out the podcast. We've got some really good ones out there. We're going to try to hit all kinds of different areas of interest in health and have some great interviews with people, but you get to see, this crazy face of mine and my guests, and we're going to try to, serve you at the highest level possible. If you want to become part of anything we're doing, just reach out and do that as well. We have our docs back out now, and you'll see them doing in-house lectures and so forth. And those of you who have companies or organizations or groups, if you'd like to have any of the doctors at the Roselle Center or come in and lecture to you and do a presentation on a certain topic, we can make that happen as well. All you have to do is reach out to Roselle Center for Healing or send me a note and I'll pass it on, but ask for Dareth Painter or Sybil McFarland and just say, hey, listen, can you set up one of the doctors to come out and give us a lecture on whatever it is? And I promise you we'll make that happen. If you come into the office or any of our offices, we have HEPA filters, so we're knocking out 99% of anything that's around there. We're keeping the office extremely safe, but we're there to serve you. Whatever your sensitivities are, we'll do our best to make sure that you're comfortable, and we make you part of the process of turning things around so you can get your health back. And remember, I'm going to give you a different side of the puzzle as it goes through. I'm going to tell you the things that you can do to help yourself. I'm going to show you that if you keep your vitamin D level nice and high, meaning well above 50 on the scale, the laboratory levels around here are usually 30 to 100. Your sweet spot's about 75 or 80. And, I'm going to tell you a real quick news item when it comes to that. The World Health Organization just published a list of countries around the world that have the greatest morbidity and mortality rate when it comes to COVID. And unfortunately, the United States is pretty high. But the one country that is way down at the bottom? It's Sweden. Remember in the beginning, they didn't mask, they haven't vaccinated, they haven't isolated, they haven't done anything. Guess where they are when it comes to mortality and morbidity? Number 40. Why is that? It's because they have part of their healthcare policy that every year everybody's measured for vitamin D. And if your vitamin D is low, you take vitamin D. So you got a country that's taking a ton of vitamin D, so they're not getting sick. Interesting, right? Let me know what I can do for you. Let me know what interest that you have, and make sure you check us out. Go to drtomroselle.com. We're here every Sunday trying to bring you the pieces of the puzzle that you're not going to get anyplace else. Try to make it a little bit of controversial to provoke you, to make you think. And if I can do that, perhaps we've made your life better, longer, and at a much higher quality. That's why we do what we do. And we continue to provide that information both inside and outside the practice. And as I teach worldwide, I do it for one reason, and one reason only. It's simply this. I love you all. Have a great week. I'll see you next time. Bye.
This is Dr. Tom Roselle, author of Ageless Health, Health is a Do-It-Yourself Program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself Program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.